Might as well.
Yeah.
All right. I think that's helpful. So we'll see.
All right. Hey, everybody. Happy Thursday. I usually say happy Wednesday, but not today. We're going to wait just a few minutes and we'll let people hop on here with us. Hopefully they tune in and they're not outside enjoying this nice weather.
I know. And I was a little worried about, I think it got published on Facebook in Mountain Standard Time, and I was like, I feel like people always think everything is in Central Standard Time.
Yeah.
So I'm worried that they might have gotten on like an hour ago and nothing was happening, but hopefully not.
Hopefully they come back, if so.
Yeah.
Hey, Janice. Kathy's with us.
Yeah. Did you guys finally get some rain there in Kansas?
Say that again. You're kind of cutting out there.
Oh, I just said, did you guys finally get some rain?
We did. We got quite a bit of rain here in our area anyways. I think almost 3 inches just in town and a little more west of us.
Good.
So much needed.
Yeah. It's funny. It's weird here today because it's very smoky.
Oh, really?
From all the wildfires in Canada. So it's coming down here.
Right.
And just seems really eerie for May to already have smoke from wildfires kind of freaking me out.
Not good. Yeah. All right, well, we're going to go ahead and get started. Everybody, we have Dr. Lacey with us back today, and she is going to discuss the most common causes of bovine lameness, the best courses of treatment, and when it may be necessary to head to your veterinarian. If you have any questions, as usual, please put those in the comments. She's here to answer all of them. And with that, Dr. Lacey, we're going to turn it over to you.
All right, thanks. Well, I'm really excited to be here with you guys today to talk about a topic that's kind of near and dear to my heart because it's what I did some of my research on when I was at Kansas State University and growing up in the purebred side of the cattle business. Structural correctness and foot and leg health, was really important and something my parents put a lot of emphasis on in our breeding program. And I kind of got to see why the more I got involved with other operations and seeing some of the issues that can arise and really the increasing amount of lameness cases that we were seeing there at Kansas State University and that I continue to see now in clinical practice. And so I think there's a lot of things we can do as producers, as veterinarians, to help these animals and try to salvage them and get them to recover and get back into a productive lifestyle. So one of the things about lameness and the reason that it's such a paramount concern is that in the beef industry, next to bovine respiratory disease, it's the next most costly animal health issue to our industry. So it is a big deal. I know none of us like to see lame cattle when we go out to check our cows. And, it's always really annoying, if you will, to know that you've got to go catch that one and see what's going on. But I encourage you, the sooner that you can intervene in these lameness cases, the better your outcomes will be. And so we're going to talk about that today a little bit and what to look for. Definitely pulling up that foot and taking a look at it and seeing if there's anything puncture in there, seeing what kind of lesions are there, can definitely help you guide you in what direction you need to go for treatment, or if it's something you actually need to take to a veterinarian to really have a more intense treatment protocol. So like I said, pretty important because it costs the industry a lot. Basically that shows up in not only decreased weight, but also decrease in longevity in the cow herd. So that's one of the reasons we lose some of our cows, sooner than we'd like to. Sometimes it can be from lameness, and that's especially true in the dairy industry, where they're more intensive systems and have to spend a lot of their life on concrete. So something we really want to be concerned about. The other thing is reproductive failure. So I don't think a lot of people always connect those two, but when they're lame and their cortisol levels are high because they're in pain and chronic pain, that has a big impact on not only semen quality in our bulls, but also can have fertility impacts on the cow as well. So could be another costly issue. And then, of course, just the profitability that's lost when cattle don't feel good. They're not getting to the bunk as frequently, or they're maybe not getting out and grazing like they should. And so, of course, you're going to have lost performance that way as well. So it's a big issue when it comes from a business perspective, and additionally from a welfare concern perspective, right? Because all of us want our cattle to be healthy and to do well. And unfortunately, the chronic pain caused by lameness, or even acute pain caused by lameness, really has a welfare impact. And we want to minimize the amount of pain those animals are feeling and do what's right for them to get them, feeling good again and healthy. So today we're going to talk a little bit about the most common reasons that we see lameness develop in cattle, and then of course what we can do about it. So one of the things, contributing factors, so there are quite a few that can impact why we see these problems arise. One of those being some of the things we can control anyway, nutrition. So if they're pushed really hard on a high carbohydrate diet, in some of our bull development yards, heifer development yards, occasionally we're trying to maximize, the gain on those animals and reach their full potential. But if we feed them a little too hard, sometimes we can see acidosis develop. And when acidosis develops, which basically means their rumen pH is too high from the carbohydrates they're ingesting, and they probably should have a little bit more forage in that diet. But the acidosis causes the rumen to get a little leaky. And when that happens, bacteria escape the rumen and get in the bloodstream, and then those bacteria can cause issues. And one thing that we see result from that is white line disease. And so when we look at the bottom of the hoof, the white line is actually widened a bit. And so it's where the lamina come together there. And then you can see laminitis, which causes pain and inflammation of that lamina propria, that level of the hoof. And just like in horses, when they get laminitis, cattle can be really painful in the short term. And it can have some long-term implications too, in that the hoof doesn't grow properly. So then they actually get overgrowth, and they might end up needing trimming more often if they have had chronic acidosis. So nutrition is a big one that we can actually help control to decrease the amount of lameness that we see. The other thing that I think is really a big contributor, and something that as especially seed stock breeders we have control over, is genetics and genetic selection. So we're finding that, as we've put increasing pressure, selection pressure for some of our production traits like carcass quality and milk production and growth, at times we've maybe not focused as much on some of those other production traits, such as fertility, such as longevity, such as natural disease resistance. And I think foot and leg health is another one of those that, because we don't see sometimes a direct correlation in profitability the way we do with cattle that attain a prime on a grid, it's just not as black and white. We tend to put more emphasis on those carcass quality traits and then maybe ignore the quality of their feet. And so sometimes we end up paying the price for that. And so just trying to put a priority on cattle that have good hoof quality, good foot angle, and those that seem to last in your herd longer, I think is important. We're finding out that especially screw claw, which we'll talk about a little later, but that happens when the P3 and P2 bones, so the foot has 3 bones in it. I'll show you a picture here in a minute of kind of the structure of the foot in a cow in each claw, but each claw has basically 2 bones in the foot as well as the navicular bone. And if the P3, so what would be the tip of our finger, if that little bone isn't lined up right with the next bone, which would be our second bone there, if those two are malaligned, then they put pressure on the hoof in an abnormal way, and it causes that hoof to grow over. And so when we see that overgrowth, basically it forms what we call that like scissor claw look, where the toes end up crossing. And so that can cause a lot of problems down the line in terms of ulcers, where that overgrowth, where they come in together like that, and then they get sores underneath. So screw claw, genetic, it is heritable. Keep an eye out for that. If you see toes that cross, that's a bad sign. So you want to try to maybe not keep those heifers in your replacement herd, or if you notice a bull that's developing that issue, maybe decide to not use him the following year, just to minimize the genetic impact of those things on your lameness issues. Another thing would be environment. So if you have a lot of, well, for instance, in the Flint Hills, which have tons of rocks, kind of where Valley Vet is located. They're beautiful and it's great grazing country with good grass, but those flint rocks can cause abrasions in the feet. So when cattle are out there, if they're getting these little nicks from really rocky, harsh pastures, those are ones that you're probably going to have to pay a little bit more close attention to in terms of checking them more often to make sure that bacteria haven't gone in through those abrasions in the hoof to cause problems. So environment in terms of not having, as many rough things, but obviously you can't control that all the time where you're having to run. But having freestanding water in pastures can predispose them to more foot rot issues, as well as just a lot of excess mud. So those are things we can kind of control. And then intensive management systems. So like we were talking about earlier with dairies having to be on concrete more often, that causes the soles to get a little thinner. So if you have show cattle that are on concrete a lot, dairy cattle, you don't want to take those soles too thin if you have their feet trimmed, because that can lead to some bruising and ulcers and other issues. And then in feedlot sector, we see concrete that has the deep grooves in it so that cattle get better traction, which is great. So they don't fall down as much when they leave the chute. But also if they have to go through those systems multiple times, they're more apt to basically wear down their toes on that concrete, and that can lead to toe abscesses and infection in that P3 bone that's in the end of their toe. So those are some of the contributing factors that we see often, nutrition, genetics, and then the environment that they're in, and then the systems that they're in. So keeping that in mind, those are all things that we can kind of try to do the best we can to control. But inevitably, you're going to have lameness. And so how to identify those cattle, I think, is important, and finding them early. The obvious lameness is like when they're grade 5 out of 5, which means they're non-weight bearing lame on one leg. Obviously, anyone can pick those out. So that's not that hard. But some of the more subtle lamenesses, or at the beginning of the disease process, is, I think, really important to kind of get used to looking for some of these indicators that tell you when they're starting to get lame. So just to talk a little bit about the locomotion scoring that we use in veterinary medicine, just so that we're all kind of on the same page when we're talking about how severe is the lameness, and so we have a scoring system from 0 to 5, with 0 being totally normal and 5 being non-weight bearing lame on one of the legs. So they don't even want to put weight on it. And so then the more subtle lamenesses, so number 2 grade lameness would be that they stand with a flat back, but when they're walking, they kind of arch their back a little. So something's a little out of whack. That'll tell you when the back is arched. It's even more obvious, I think, in dairy cows than beef cows, but grade 2 is pretty subtle. A lot of times I would say it goes unnoticed, and sometimes doesn't need to be addressed. I think when you get in the grade 3 lame, that's when you need to really pay attention. And grade 4 is commonly associated with septic arthritis. And we're going to talk more about that in a minute too. So really severe cases start to be seen at grade 4 and grade 5. But grade 3, which I'm going to have her play a video here in a minute of a cow that I would classify as probably a grade 3 lameness, so that we all are kind of aware of what I think that looks like. And it would be the early stages of a foot rot case. And so you're going to see that her back is arched when she's standing and walking a little bit, but she mostly has a shortened stride on her right front leg. And you can see a head bob as well. So just like in horse lamenesses, cows also lift their head when they place weight down on the foot that hurts. So if the leg that's causing them issues and pain, when they set that down on the ground, their response is to raise their head to try to take some weight and pressure off of that limb that hurts. So I might have Melissa go ahead and play this video of a black cow that has foot rot and is about a grade 3 lame. Okay. Hopefully it'll work for us.
Yeah.
And
did you want me to play that again?
Sure, if it'll load.
Sure.
There we go. Oh, there. You can she puts weight on that right front foot, her head goes up and her back arches. And then she's a little shorter in her stride on the right front. And so I know it wasn't a real long video, but hopefully you guys can appreciate that. And so basically when I see that, it tells me probably need to take a look at that, make sure it's going to resolve. Sometimes it's just a rock between their toes. It works itself out. You go back to check her the next day and she's fine. And that's great. But it probably would be prudent to go ahead and catch her, lift that right front foot up and take a look at it. So when it's foot rot, what we're going to see, right, foot rot, the infection that oftentimes is between the toes and is Fusobacterium necrophorum is the most common issue we see for lameness in cows by far. And the problem with foot rot, it's easily treated with most systemic antibiotics, which is great news for us, but also it can quickly get out of hand. And if that infection gets out of control, it goes to the deeper structures in the foot because the proximity to really important structures for where it likes to set up shop in between the toes is very close to things like the flexor tendon and the navicular bone and the distal interphalangeal joint. And so when infection spreads from just that soft tissue between the toes and goes to those structures, then it becomes much harder to treat, especially if there's bony involvement. So that's why it's so important to get on those foot rot cases early. With foot rot, in addition to seeing the visible lameness, the swelling at the coronary band, so where the hair meets the hoof, the swelling is really symmetric around both claws. So pretty much from their dew claws down, it's going to be pretty swollen, right? Pretty obvious. And it's not going to be like the swelling is asymmetric on one side of a claw compared to another. If that happens, if you do see that asymmetric swelling, this is one of the big take homes from today I want you guys to remember, is that the asymmetric swelling on a claw, if it's over on one side or the other, really is a big indicator for deep digital sepsis. And that's when it's more serious. And that's when you need to take them to the vet to have probably some more advanced treatment done, because just your injection of antibiotics, whether it's oxytetracycline that you choose, or a ceftiofur, or a macrolide, doesn't really matter which antibiotic you choose. None of them are probably going to get to that deeper tissue that's infected and do the job to get them over the hump. So that's the big thing. If you have symmetric swelling from the dew claws down, and then you lift the foot up and you have an interdigital lesion, probably foot rot. If you have asymmetric swelling, just one side of the claw at the coronary band is really swollen, but the other side looks pretty normal, then you probably have joint involvement, and that's way more serious. So I'm going to have her play another video right now. Most, as far as the distribution of lameness goes, most lameness is in the foot. So I would say 90% of lameness is from the knee down, and of that, 90% is in the foot, is basically what they tell us. So in general, you can be pretty confident that if you see a lame cow, it's going to be in her foot. But this is an example of about 10% of the time, it's either in the stifle joint, which is their equivalent of our knee, and that's the video I'm getting ready to show you, or it could be in the hock joint, or even in the shoulder or the knee joint. But like I said, that's way less common. But this is an injury in an older commercial cow. And sadly, this is one of the more common reasons we see lameness in older cattle. And it's basically like our knees when we have an ACL ligament tear. Cows have a ligament very similar to us, and it's called the cranial cruciate ligament. And when that ruptures, then they have this problem, and it's essentially untreatable. There are surgeries that can be done on really valuable cows, but even those surgeries, which are rarely done, are just not that successful. They're just such a big animal. There's so much strain on that joint that it's very hard to repair. So these older cows, or even bulls, when they're mounting, get this kind of an injury sometimes. And this is very characteristic of a stifle injury. And this is one of those things that is really a reason to call, because this cow's probably just going to continue to go downhill, and we don't want her to be in chronic pain, and her prognosis for recovery is poor. So I'll have Melissa show you this video. And at the end of the video, I tried to zoom in a little bit more on right where that joint is. So it's kind of just at the backside of her flank. That's where the cow's knee is. And you'll see some swelling right there in that pocket. And that's the effusion and swelling surrounding the joint that's affected by that ligament rupturing. So here's this cow just to show you an example of an upper limb lameness.
I'm going to hide me.
We lost Melissa. Okay, and so I hope you can appreciate that she's probably a grade 4 lame on that right hind leg and really doesn't want to place a lot of pressure on that limb. And then there at the end, I know it didn't show up as well as it did, on my phone video, but the swelling surrounding that area just behind the flank, where basically her tibia and her femur come together, just like our knee, had a lot of swelling in it. And that was the issue. So they can have the ligament rupture, and they can also have meniscus injuries too. And really, neither of those are very treatable. So I just wanted to give you an example of a lameness that didn't involve the foot and show you how that cow moved and the more characteristic things you see with a stifle injury, since I do feel like, especially with our older cows, that's one we see a lot of times. So if you see swelling in that area, kind of just behind the flank, where their knee is, then that's what that issue is there. So going back to foot lameness though, I've got another video basically of a Hereford heifer calf.
Okay, is this the one with the snow, Lacey, or the
reason is she's grade 5 lame, so she's essentially non-weight bearing, and the has a joint infection. And so the joint infection is what is causing all of her pain. That's her at the end when she's been treated. So the picture this winter is the one that I'm needing up.
Okay.
Melissa?
Just a minute. I thought maybe I had the wrong one there.
Oh, no, that's okay.
This heifer calf
there you go.
Is grade 5 out of 5.
So watch her try to walk.
Which means she is non-weight bearing on her right front leg. As you can see, it's very swollen on the outside, and she's not bearing any weight on that at all. Extremely painful.
So hopefully you guys kind of caught that. And I think you could hear me talking in the background. But her right front, she's so painful, she really can't even set that foot down. So she's hopping around on 3 legs. That's grade 5 lame. That's a reason to go to your vet. Now in baby calves that young, one of the reasons that they can be that lame is if they get something like an umbilical infection. So calves are really susceptible to that after birth, right? Because that's like a wide open channel to their systems. And sometimes their immune system isn't fully developed, or they didn't get enough colostrum, so they're more susceptible to infection. Well, if they get an umbilical infection and then that goes through their bloodstream, sometimes it settles in their joints. And so that's another thing that you want to keep an eye on your younger calves. If you see joint swellings, so especially the knee joints or the hock joints, this heifer calf, it was lower towards her pastern, but that can be an indication of an umbilical infection that's turned into a septic joint situation because the bacteria went through the bloodstream. And really, one of the only things that'll help with that, the antibiotic Nuflor actually gets to a concentration in the joint fluid that can be effective if you catch it early enough. So I always recommend with my umbilical infections for producers to use Nuflor at the high dose, so 6 cc's per 100 pounds, and see if that can do the trick for you. But oftentimes, if you're already seeing joint swelling, then you're going to have to intervene with a joint flush. And you want to do that early in the disease process. So cattle love to make fibrin, which is that stringy yellow stuff in pus, basically. So they are masters at making pus. And that can sometimes be good because they can wall off infections that they get in their abdomen or basically, on their neck. They are great at making abscesses and walling that infection off so it doesn't, spread to the rest of their body. But the other problem with them making fibrin so readily is that it makes it hard to flush those joints because it forms so quickly, and then that plugs up your needle when you're trying to flush the joint out and trying to get rid of all that infection. So one of the things we say is the solution to pollution is dilution. So what we mean by that is that if you can get enough fluid through a joint and flush it out well enough. So one needle in, one needle out, you can hopefully get rid of enough of that bacteria and fibrin that you can help the animal recover. And we infuse antibiotics as well at that time directly into the joint, as well as having them on a systemic antibiotic like Nuflor. So on this heifer calf, so you saw how lame she was, really painful, definitely time to get your vet involved. And then now I'm going to have Melissa play another video, which is a little closer up view of her actual foot. So not the heifer calf, but the foot itself. And then I'm going to describe in the video kind of more in depth about how you can tell the difference between septic joint and foot rot based on the swelling that you see in the foot. Okay. So not that video. So just a foot. This is her when she's healed. We'll save that one for a little bit later. So just a close up of her foot.
I'm not sure if I have that one up here.
Oh, earlier I thought you showed. There you go.
Is that it? Okay.
And I'm going to I narrate this video a little, so I'm just not going to talk right now.
Example of asymmetric swelling at the coronary band, and the coronary band being where the hairline meets the hoof. And you can see it's asymmetric where there's a great deal of swelling on the lateral claw side, and this side is quite normal. And so that's an indication that she may have a septic joint, or as you can see, this draining abscess is causing an issue. The other place you want to look for lesions causing lameness in cattle are interdigitally. So that's between the toes, and that's usually where you're going to see a nice linear lesion if they have foot rot. She looks great. I don't see any indication of that here, but you can appreciate the asymmetric swelling indicating that she has something going on here with this joint.
Yep. So that right there is a pretty dramatic example of asymmetric swelling at the coronary band with joint involvement. And that's why she was so lame in the previous video where she was just hopping around on 3 legs, because that joint is just full of pus and it's extremely painful. And now I have another video of the same calf, and it just shows you a radiograph view of what's going on. So you kind of get a little bit of a picture of what's happening inside. And so you'll see that there's going to be joint widening where the joint that's infected is involved, compared to the good claw. That's what's nice about cattle, is you can compare when they have that kind of asymmetric swelling, you can compare the good claw to the bad claw, and it makes it really obvious on where the problem is. So you'll see in this radiograph, the joint that's infected is really widened, and you can see that the bone is really roughened around the edges. So I'll have Melissa play that one next, just to kind of give you a little bit more insight as to what it looks like with the bony structures and what's happening.
On this heifer calf, you can see the asymmetric swelling at the coronary band, and she has significantly more swelling here on this side compared to this side. And this is what it looks like on radiograph. So you can see there, she has a lot of bony lysis here in that joint right there. And so this is P3, P2, and P1. Those are the bones that make up her foot. And she has an infection in this pocket here, and it's migrated to that joint. You can see the widening of that joint compared to the normal joint on the other claw.
Yeah. So basically for this heifer calf, we were only left with like 2 treatment options, right? She's this severe, the disease process has gone on this long, that there's so much damage in that joint that flushing it alone is not going to fix her. And so for a treatment protocol at this point with a joint infection, you have 2 options: claw preserving, so they get to keep their toe, and claw amputation. And we decided with this heifer calf that probably the best option was claw amputation for her to get better quicker, and because they didn't expect her to have a lot of longevity. So what we did was, if on that radiograph, if you remember seeing where that infection was, we amputated the bone just above the joint that was infected. And it sounds like it's a harsh procedure, and it is. We do use a lot of local anesthetics. So we use lidocaine and a tourniquet. And so we make sure that that whole foot is numb before we ever start the surgery, and we sedate her a little as well. So before we do that surgery, she's not feeling any pain there in the foot. And then we surgically cut between the toes, and then we saw basically off of that bone, that P2 bone, and we just take off that whole claw and the infected joint. And you would think that that would cause her a lot of issue, but you would be shocked at how quickly they recover and how quickly they are out of pain. It's kind of amazing. And so when you take the joint that's infected off, even though you've cut through the bone, those nerves in the joint that were so mad and inflamed are now gone, and they heal really rapidly, especially calves that age. So basically we put a compression bandage over that. After we amputate that claw, we put a compression bandage on to protect that piece of bone that's exposed. And we have the owner change the bandage every couple of days until there's enough tissue covering the bone to leave it off. So the hair doesn't have to fully, the skin doesn't have to fully cover the surgical site. We just need the bone covered. And that usually that takes about, 14 days at the most. And so maybe they need 2 or 3 bandage changes, and then they're good to go. And so the final video of her is just 6 weeks after her surgery, and it's her out in pasture. The owner sent this to us, and she is just bebopping around, doing great. So there she goes. And so she went from being grade 5 lame, where she's hopping around on 3 legs, and then we remove that claw, and you can see she looks a little funny. So it's not the most cosmetic procedure, but it definitely is helpful in that it gets them pain-free and back into production. Now, her longevity as a breeding animal will be shorter, and so that's why we try to avoid that if we can. But as far as getting her, getting back on the cow in the pasture, she's going to wean off just fine, and she'll still have salvage value. So that's one option that you can, if the infection gets out of control and goes and becomes deep digital sepsis, that's one of the ways we can treat them. Now, another way, and especially for more valuable animals, is more claw preserving options. And so that includes the joint flushing we were talking about earlier, or facilitated ankylosis, which is a big fancy word that means you are trying to get the bones to grow together. So like in that radiograph picture where you saw the widening of that joint space, we go in and we remove all the infected bone, and that's the goal of that procedure. So surgically, we're not going to take the whole claw off, but we're going to go into the joint, we're going to scoop out all the dead bone, and then we're going to flush it, and we're going to leave a draining track there. And then the problem with facilitated ankylosis, because it sounds like it's a better option, but it takes a lot more time. So they don't fully heal from that procedure for sometimes 6 to 12 months, as far as basically recovering to full soundness. And the other thing is sometimes the other claw in really heavy animals like big bulls, depending on which claw is affected, then the other claw might start to break down later on. So it's not really that practical in a lot of situations because it does take longer. You have to flush that joint multiple times after you've removed that dead tissue. And so sometimes that's not the best option. But if it's a valuable animal and you have a very committed owner and you want to try, that is something that a lot of us as veterinarians can offer you. And so that means just trying to get rid of all the dead tissue in the joint, and then having those 2 bones essentially fuse so there's no joint space left, so it grows together. And that only works in joints that we call low motion. So if it's a high motion joint like a hock, you really can't do that because they need to be able to flex and extend that joint. But in a joint like in that calf's foot where it doesn't have to move very much, you can absolutely do that, and it can be successful. So just some things to consider. Thought maybe we should start taking some questions now. What do you think, Melissa?
Yes, we do have a pretty long one here. Angie asked, she says, we raise registered Texas Longhorns, and one of ours seems to have chronic feet issues where she gets cracks in the claw of her hoof. Actually, right now, both her front outside claws are cracked. She is not lame, but definitely puts her feet down differently than she should. We are looking to do something with her, but not sure what to do. She has had her feet trimmed a couple times. She's probably due for it again. Is there something special we could do for trimming? Anything we can give supplement wise? And then she says, and we are having trouble with her reproductively also.
Oh yeah, so those vertical cracks or fissures that we see are really frustrating and hard to treat sometimes. Sometimes I think we're finding that there can be a genetic component to those developing. Keeping her feet shorter, which it sounds like you've already trimmed her a couple times, can help reduce the amount those cracks spread. And then teeing the crack off, so almost like when you get a runner in your pantyhose, you know, if you can tee it off at the top before the crack reaches the coronary band, because that's when they become really painful and sensitive, is when the crack extends all the way from the toe all the way up to the coronary band, and if it gets infected down deeper. So taking it to a hoof trimmer that's familiar with how to manage those cracks, as far as taking a Dremel and really opening that crack up so that bacteria and dirt don't get caught up under the lip of that hoof wall, because that's what happens a lot of times. And then anaerobic bacteria love to set up shop in those areas. And so opening that crack up and dremeling it out sometimes can help, and then teeing it off at the top so that it doesn't spread further proximally is also beneficial. Some people have even the really deep cracks. Sometimes you might even have to wire them kind of together or use epoxy. We don't often reach for those options, but in cases that are severe, you might need to. Sometimes if selenium is over supplemented, I've heard that it could contribute to vertical wall cracks. That's not very common that happens, but you might want to look at the selenium levels in your feed and mineral. The other thing supplemental to add would be like a biotin supplement. There's tons of those out there for horses, and you know, some of it will get digested by the rumen, so I'm not sure how effective it will be, but you could try supplementing her with a little bit more biotin to promote hoof health. But yeah, the vertical fissures are really frustrating. I've noticed in my own cow herd that I think there is a genetic component to it. So unfortunately, in some ways it's hard to manage. But if you keep her trimmed regularly, that should help significantly. And then if she becomes lame on one toe more than the other, one thing that we do when I'm working on cases at the clinic, if it's a sole ulcer that's just affecting one toe and not the other, what facilitates that healing better is to take the pressure off of the bad claw for a while. So we will glue a wood block to the good claw, and basically that's based to just elevate the bad claw. So if you're putting a wood block or a rubber block, we use a few different ones, different sizes for different cattle, and we glue it on with a special Bovine glue that's long lasting and really a strong adhesive. We can keep that wood block on the good claw, which elevates the bad claw. And then that way they're not putting as much weight on that bad claw. And in some ways that allows those cracks to go ahead and start to heal a little better, or sole ulcers to heal, because they don't have the constant pressure causing that separation of the hoof wall and also causing them pain. So it allows things to heal a little better and keeps them more comfortable in the meantime.
Okay, this one's from Christy. She asks, zinc sulfate versus copper sulfate hoof bath. What is best for Louisiana weather?
Oh, that's a good question. So both of those can be helpful as far as minimizing foot rot infections. Dairies use, I would say, I feel like they use zinc sulfate more often than copper sulfate. Copper sulfate, you know, most people are more familiar with the copper tox product, the green smelly stuff. And that is known to help harden the soles a little bit on cattle. So I use it on cattle who maybe their soles are a little soft or they have thrush in some areas. I'll use copper sulfate, so the copper tox solution on those feet. But I think the zinc sulfate, like a 10% solution foot bath, is a great option. I know it's not really practical for pasture settings, but in confinement areas, dairies, or even show cattle, things like that, you know, walking them through a zinc sulfate bath or zinc oxide is not a bad idea at all. Okay, I think they both are pretty effective. So the one thing I will say about the copper sulfate that you have to look out for is that if you have an open lesion in the foot, there's some evidence that it can impede healing. So if they already have a wound in their foot and you put copper sulfate right on it, it can be a little caustic and can be, actually slow down the healing process. So you don't want to get too aggressive with your copper tox and that kind of thing. Just one little side note.
Okay, this one is from Wes. I have an older Dexter that is starting to fall behind, limping. She is chondro. I feel the disease is the reason, but her last calf, which is a bull, has a slowness also. This makes me have more questions about the mother. Could the chondroplasia create a problem right off start of a calf, 6 months, which also seems to be chondro?
Yeah, I do feel like conformation skeletally of the animal, it does affect overall structural correctness, soundness. We see that. And in some ways we can see that as in the angle of their shoulder and in their posture, even in how their feet hit the ground. So do they toe out? Are they valgus? We call that when they toe out this way. So then they're putting more weight on those inside claws and maybe inappropriately. And that can cause basically cows' response when they have additional pressure on a hoof is to grow more in that area, which is, so you would think they would wear it down faster. But when they, like, let's say they toe out, and so they're putting more pressure on their medial claws. So the inside toes are where they're putting more pressure because they toe out conformationally. That inside toe is going to grow faster than their outside toe. And so then it just exacerbates the problem, right? So it makes things worse. And then the problem becomes the pressure that's put on the joints. And because of those angularity, we call those angularity deformities. And you see those horses, cattle, anything, where they can be pigeon-toed and toe in, or they can toe out and be valgus. And that puts stress on the joints. And then that can result in issues with, osteoarthritis. And sometimes they just don't last as long. So in addition to foot problems, you can see issues with joints, and it just puts additional strain on those joints, just like people as they age. So yeah, the chondroplasia that you're talking about genetically in those Dexter cattle, I definitely think that could be an issue, especially if you have like tendon laxity. So let's say they're more down on their pasterns. So instead of, like, if this is their toe, instead of being at a correct angle here, they're more down on that, have more laxity in those flexor tendons, then that's going to put more weight on their heel, and then their heels are going to wear down, faster. So I do think structural correctness, conformation, all contributes to lameness issues. So basically my answer is yes. I feel like you probably could be seeing that even in a 6-month-old calf.
Okay. This is from Kathy. Should ponds be fenced in? Last summer's drought brought on foot rot in my Angus cattle.
Yeah, I would say if you have other water sources and you can afford to fence cattle out of standing water, it will benefit them. They use that as a source, obviously, to get rid of flies and to try to cool themselves off. But in doing so, if they have any little abrasions in their feet, and then they expose those abrasions to the bacteria that likes to live in the mud and in those wet places, they are more predisposed to developing things like foot rot. And so if you can keep them out of there, I definitely think it's worth it. There are some other issues as well with them drinking out of ponds and things like that. Leptospirosis is a disease we deal with, and those spirochetes that are shed in the urine of deer and mice and other wildlife, they can live in standing water, whether that's puddles or a pond, and that can lead to infection in cattle as well. So there's multiple reasons why, if you can keep cattle fenced out of ponds, not to mention the fact that they sometimes get stuck in ponds, and that's always really fun to deal with. So yeah, I think if you can afford to fence them off and you've got other water sources available, I would suggest doing it. I think it will make your life easier. That also, to talk about pastures that are more predisposed to foot rot, or years where we feel like the foot rot is worse, I'm sure people have a question about, do you feel like the foot rot vaccine is of value? And I would say, anecdotally, some of my producers feel like the foot rot vaccine really has helped them. And it's a Bactrin, so it doesn't have as much duration of activity as some of our viral vaccines, but it can be helpful in fighting off Fusobacterium infection and foot rot. So it does oftentimes require a booster vaccination. So keep that in mind to get the most out of it. But especially in the bulls where people are really worried about bulls going lame in the middle of the season, or maybe those bulls are going to be out in really rough country and hard to gather. They just want to try to get as much insurance that they're going to stay healthy as possible. And so they use the foot rot vaccine and have had some success with it. So while there's not a ton of data out there to support that it's, a bulletproof prevention option, I do think in certain situations it can really help. So if you've been fighting foot rot and it's been a chronic issue, that might be something to consider this year.
Okay, this one's from Stan. You mentioned the swollen joints at birth being a possible naval infection. I've been having a number of newborns with swollen knee right after birth, and they are definitely getting a good start or good colostrum. You mentioned Nuflor as possible treatment. Any other antibiotics, possible causes, possible treatments?
Okay, so great that you're pretty certain they've got good passive transfer of immunity. So you feel like they got good quality colostrum and enough of it, early on in life. So maybe it's not an infection. If it's just swelling and they are not exhibiting signs of lameness, then it's less likely to be a septic joint. So meaning that there's actual bacteria in the joint. Usually if they have a septic joint, not only do you see the swelling, but they're really ouchy. They lay around a lot because their joints hurt so much. And they definitely show signs of favoring the limb that is affected. If you aren't seeing that, that's a good thing. And so maybe it's just excess joint fluid on those knees. And maybe that's because their conformation is such, or that they're developing a little extra fluid. Sometimes if they have contracted tendons when they're born, so their pasterns are stuck in kind of a flexed position, and sometimes their knees can be bowed out a little bit, and maybe that's genetic, or maybe they were just a really big calf in a small womb and they were, in a weird position in gestation. But that can also kind of show up in the ways that you're describing there with kind of swollen knees. But hopefully if they aren't lame, you don't necessarily need to treat with antibiotics. I would take their temperature, see if they're above 1015. We consider that febrile for the most part. And so if you feel like the umbilicus, when you palpate it, is painful to them, and if it's larger than, let's say, the size of your index finger, then it probably is the naval infection that could be leading to this joint issue. If they don't have a fever, if they're not lame, and if the umbilicus palpates normally, meaning that it's not hot or painful to the touch or swollen, then maybe it's just some excess fluid on the joints. And I can't exactly say why that might be. Conformation sometimes contributes to that. Mycoplasma infection is another bacteria that can sometimes result in swollen joints and settles there. And it can be pretty devastating because it's a very hard disease to treat, the mycoplasma infection. Calves that young, I'm guessing it's probably not mycoplasma. At least I'm hoping not in your case. So hope some of that was helpful information. If it is mycoplasma you're dealing with, a macrolide is your best choice treatment-wise, even though even those are not as effective as we would like them to be, because the mycoplasma bacteria doesn't have a cell wall like some of our other bacteria do. So it's harder to kill. But macrolides, things like Draxin, Mycotil, Zuprevo, Zactran, all those are in that family of macrolide antibiotics. So if you feel like you might be dealing with the mycoplasma issue, which also sometimes shows up with down ears and otitis interna, so they get really bad ear infections with draining ears, and then it can also show up in the swollen joints, then those would be good treatment options for that.
All right. Well, that's all for the questions for now. Okay. I just want to remind everybody this will be on our Facebook page and our YouTube channel. If you'd like to go back and watch it, you can find them there. Dr. Lacey, did you have anything else to add before we wrap up today?
I guess the only other take home, besides trying to discern if it's run-of-the-mill foot rot that should respond to almost any of your antibiotic choices, or a septic joint, the other take home from this whole talk that I wanted to instill in everybody is that if you treat them for what you think is foot rot and they don't respond within 24 to 48 hours by getting significantly better, they won't be 100% sound and the swelling might still be there. But if they don't look like they're moving quite a bit more comfortably at 2 days after you gave them an injection of antibiotic, then there's probably something more sinister going on. And that's when you need to take them into the vet before it gets out of control. And then you don't have very many options for treatment. So often when we see cattle that have been treated with antibiotics like 4 times, or they're like, well, I tried this antibiotic and that didn't work. So I tried another one 2 days later and they're still not better. If that's the case, then it's probably not just a superficial lesion between the toes caused by foot rot. It probably involves the deeper structures, and you're going to have a vet or someone, get that foot really evaluated, tilt the animal over or lift the foot up and try to get out a lot of that infection, and maybe even do some of the treatments we talked about that are more invasive to try to get the animal over that. Otherwise, it's just going to become this snowball of infection where it starts superficially, then maybe it goes to the flexor tendon, then it goes to the navicular bone, and then you just don't have very many options. And then the animal's in severe pain. So I just want to encourage you that if they don't look a lot better in 48 hours after you treat them with antibiotics, go ahead and take them to the vet, because it's probably going to need something more than just a shot of oxytetracycline. Okay.
All right. Well, if you guys have any more questions, please don't be shy. Put those in the comments. We'll get with Dr. Lacey and we'll get an answer for you. Oh, we have one more come in here. Janice had a question about the stifle joint. Got an older cow. We thought it might be her hip, but after listening here, I'm thinking that it might be joint. She's 12 years old.
Yep. I mean, I would say that given that history of her age, and if you think she has swelling in that location, it probably should be higher up on your list. Like I said, sometimes it's harder to discern whether that lameness is really starting in the foot or is the lameness actually in the stifle joint. But if there's no swelling in her foot, or you've lifted her foot up and looked interdigitally for any lesions, any signs of infection, and you don't see it, and if you palpate up around that knee and you feel a little extra fluid, that's probably what's going on. And you can always palpate the other joint on her good leg and kind of feel what the normal knee joint should feel like, which with the bones being pretty prominent, and then go back to the joint you feel like could be affected. And that will tell you oftentimes what it is. The other thing, pelvises can be fractured, especially with like breeding injuries or in the ice and things like that. It's less likely. Those upper limb lamenesses, like I said, are only about 10% of the lamenesses we encounter. But when they happen, they can be devastating. So, bulls can avulse their shoulders, so they can get shoulder injuries. And that can be devastating, and they can even get shoulder joint problems, just like humans do. And then cows with that hip joint can actually get knocked out of place, and it's really almost impossible to get that coxofemoral joint back in the head where it's supposed to go. So that's another reason to probably cull a cow or go ahead and put her down if it's really severe. So I'm sorry to hear your old girl is doing well, but she unfortunately, seems to be, especially with like Angus genetic cattle, it seems like as they age, that cranial cruciate ligament wants to give out. And it can either be a total rupture of the ligament or even a partial tear can cause pretty severe lameness. So might be what's going on there.
Janice, she's
a
diva.
Those are the best. Sounds like you gave her a nice long life, so that's good.
All right.
Well, guys, I appreciate it. And thanks so much. And if you have questions, you can always shoot an email to Valley Vet or give us a call on our veterinary hotline, and we're happy to help out or offer any advice. And hopefully your local vet can help you with those more advanced lameness cases, because like I said, I don't want you to give up on them, but if they don't respond pretty quickly to your antibiotics, I really encourage you to get them seen by a vet so that you have the best chance possible of them recovering.
All right. Thanks, Dr. Lacey. We appreciate it. Thanks for joining, everybody. Before you hop off here, one quick announcement. Make sure that you join us May 31st. We are going to be live with Judy Auble from Myler, talking about how to transition your horse to a new bit. And that's all today. Thanks, everyone, for joining.